Hello and welcome to the Governor Elections Candidate Briefing for the 2024 Governor Elections at CUH. My name's Jason Clark and I'm the Trust Secretary. Within this presentation, I will give you an overview into the role of an NHS Foundation Trust. We will also go over the role of members, the role of governors, the role of the board, the time commitment involved, and look at the next steps in the election process. I will conclude by going over some of the most frequently asked questions. NHS Foundation Trust was first established in 2004 and CUH was one of the first 10. Currently, there are just under 150 and these include acute hospital trusts, community and mental health providers, ambulance trusts and integrated trusts. All NHS Foundation Trusts are regulated by NHS England and the Care Quality Commission. This slide shows the role of members, governors, non-executive directors and executive directors at CUH and the linkage between the four. Governors are made up of our members and are responsible for holding the non-executive directors and ultimately the board of directors to account for the performance of the trust. They are also responsible for reflecting and representing the views of those within their own constituencies, the patients, the public and staff. You can be a member at CUH in one of three constituencies: public, patient or staff. At CUH, we elect the majority of our Council of Governors and have 19 elected members and 10 appointed members who are partnership governors. You must be a member to be a candidate and to continue as a governor if you are elected. But if you are not currently a member, you can join during the nomination and election process. Members can only join one constituency and will therefore only have one vote in that constituency per election cycle. The current composition of the CUH Council of Governors is 8 patient governors, 7 public governors, 4 staff governors and 10 appointed governors who are partnership governors. These include organisations such as Cambridgeshire and Peterborough Foundation Trust, the University of Cambridge and the Cambridge City and Cambridge County Councils. Elected governors can normally be elected for 3-year terms and may serve up to a limit of 9 years made up of 3 individual 3-year terms. As previously mentioned, the Trust limits individuals to a maximum of 1 NHS Foundation Trust governor role. To be a governor at CUH, you must be at least 16 years old. As previously mentioned, CUH only allows governors to be a governor at 1 NHS Foundation Trust at any one time. Therefore, if you are currently a governor at another NHS Foundation Trust, you would not be eligible to apply within CUH. To apply within the public constituency, you must live within the constituency boundaries shown later in this presentation. To apply under the patient constituency, you must be a patient or a carer of a patient who has received services from the Trust since July 1948. To apply as a staff governor, you must be a current employee at CUH or on a fixed term contract of 12 months or more. This is also open to volunteers. These are the boundaries for the public constituency, which you will see extends into parts of Hertfordshire, Essex and West Suffolk. If you are a current CUH member, you will fall within those boundaries. But if you do have any queries, do contact us and we will let you know if you are eligible or not. The essence of being a great governor is in using your voice to make a real difference to the patients, public, carers and staff at CUH. We're now going to play a short video clip. Members of the Council of Governors undertake and support a number of key roles and responsibilities. These include representing the interests of members, public, patients, and staff in the governance across the Trust, to individually and collectively hold non-executive directors to account for the performance of the board, and to feed back information about the Trust, its vision, and its performance to members and the public. In addition, governors and members of the Council of Governors undertake and support the Trust across a number of other key roles and vital functions. These include appointing and removing the Chair and non-executive directors, deciding the remuneration of the Chair and the non-executive directors, inviting members of the board to attend Council of Governors meetings and to discuss key elements of the Trust's affairs, appointing the Trust's external auditors, receiving the annual report and accounts and the auditor's report, and expressing views on the Trust strategy, annual plan and quality account, and on other major decisions. The Board of Directors is made up of non-executive directors and executive directors, and ultimately is responsible for ensuring that decision-making is effective and the right outcome is reached when decisions need to be made. The board is responsible for ensuring that CUH delivers safe, effective services in a caring and compassionate way, which is responsive to the changing needs of patients and service users. The board is also responsible for ensuring that there is real engagement with stakeholders and strong local accountability. We absolutely recognise that governors will be able to commit different amounts of time to the role based on other responsibilities that they may have elsewhere. The absolute minimum requirement is to attend 1 in 3 of our Council of Governors meetings, which are held on a quarterly basis. These meetings are scheduled at least 6 months in advance and, during 2024, will be held on Wednesdays during the late afternoon and early evening. We do offer these meetings as a hybrid, so you can attend in person or virtually. During the 2024 elections, we have 3 vacancies within the public constituency, and these will be for a 3-year term starting on the 1st of July. We have 3 vacancies in the patient constituency, which will be for a 3-year term starting on the 1st of July. And we have 2 vacancies in the staff constituency, which will be for a 3-year term starting on the 1st of July. Should you wish to seek further information or have a follow-up conversation, this can be requested by emailing cuh.foundation@nhs.net, and myself or one of my colleagues will be in touch to respond to your query. Nominations for the election process opened on the 26th of February and will close on Monday the 25th of March at 5 p.m. The full election timetable and nomination packs are available by going to www.cesvotes.com/CUH 2024. If you are not currently a member and would like to be involved in the election process, you will need to complete a membership form, which you will be able to find via our CUH website. I'm now going to address some of the frequently asked questions that have been raised during our previous briefing sessions as well as via email. The first question, and the most frequently asked question, is around the time commitment. As previously mentioned, the minimum time requirement or time commitment is to attend at least 1 in 3 of our Council of Governor meetings that are held on a quarterly basis throughout the year. We do recognise that governors will have other roles and responsibilities and obligations outside of their role as a governor that they will need to balance alongside that role. The more time you are able to commit to your role as a governor, the better you are able to serve your constituents as well as support in other governor-based roles and activities. The next question we've been asked is, I live on the outskirts of Cambridge, am I eligible? As shown earlier in the presentation, we have a public constituency boundary, and if you fall within the highlighted area in that boundary, you will be eligible. If you have any queries, please do not hesitate to contact us on the email shown earlier in the presentation, and we will actively seek to support you. The next question we've been asked is how the election process works. As mentioned, we have 3 vacancies in the patient constituency, 3 vacancies in the public constituency, and 2 vacancies in the staff constituency. Members across each of those respective constituencies will cast their votes, and the 3 highest in the patient constituency, the 3 highest in the public constituency, and the 2 highest in the staff constituency will be successfully elected. The next question we've been asked is, can I campaign for votes? We would actively encourage people to let members know that they are seeking to be put forward in the nomination process for the election, and to actively seek to encourage people to vote for you. How you wish to do that is up to you, but anyone that votes for you will need to be a member. So if they are not currently a member, they will need to apply to be a member, and that will need to be done before the nominations close on the 25th of March. The last question that we've been asked is, do the incoming governors overtake the roles of the previous governors? The answer to which is no. So if you come in as a governor, you would not be expected to fulfill the roles of the previous governors if they were doing specific work around supporting a committee or observing a committee. We would sit down with you individually as a team with the lead governor and look to understand where your skill set was best suited and how you would best feel able to support the Council of Governors. That concludes the presentation. Thank you very much for taking the time out to listen, and as previously mentioned, if you have any additional questions or queries, please do not hesitate to let us know ahead of the nominations closing on the 25th of March at 5 p.m. Thank you very much.